So C1, the spinous process of C1, it's C1 doesn't have one, so it's kind of, you're not gonna try to palpate for that. But if you find the end of the occiput bone and then just walk your fingers or just travel your fingers about a finger breadth, like you feel on the spine, the next spinous process you feel there, that's the spinous process of C2. And then to find yourself, if you just flexed your cervical spine a little bit, you can feel that bone just pop into your finger right there. So that's a very important landmark when you're trying to find the soft tissue around it. So for this palpation here, it's a little bit more comfortable to go with both thumbs. You know, I know if you guys remember that the spinous processes on the cervical spine, they bifid. So sometimes it can be, you know, if you just go with one finger, it can be a little uncomfortable. If you go with both thumbs. Another thing that's good with the both thumbs that you can do is just kind of grab, I'm not grab, but just hold the patient's soft tissue on the side and kind of do a little, pull up a little bit, just to give a little more slack, and then just, you know, go for the landmark you're looking for right there. So once you find C2, and then you can just kind of work your way down for C3 all the way down to C7. So if C2 is right there, then the next, you know, bump down, that's going to be C3. So from there, it's just working yourself down. And again, you can do this sitting as well, you know, just finding C2. So when they're relaxed and they have, like, if you have a table with the hole there, and they're relaxed, is not that difficult to find. So pretty straightforward for the spinous processes. You don't have to spend too much time as you guys have any questions. Okay, the main thing is go with both thumbs, so be a little more comfortable for them, and support the soft tissue around and work yourself all the way down to C7. You know, you guys know that C7 is the most prominent. So once you get there, that's all the cervical spinous processes. Okay. All right, so turn around for me, please.
Turn over.
Yes. So the transverse cross of C1. So we do the patient supine this time, and then your reference point here will be like just the mastoid processes. So the spinous process of C1, it comes, you know, all the way out, like laterally on the neck. So once you find like the mastoid processes, it's just a finger breadth, like inferiorly from the mastoid process or from the mastoid processes. So it can be a little tender there, and the patient probably can tell you that. But and just to confirm that you're there, you can just move the patient's head side to side or have them rotate. So side to side. But if you do passively, you can kind of feel a little bit more. So it's basically you find the mastoid process on each side. You can palpate bilaterally, and you just kind of slide your finger down about a finger breadth on each side, and you can feel a pointy landmark right there. That's the transverse process of C1. And then from them on, you can just slide your finger down a little deeper. And again, that can be uncomfortable with tender. So just kind of start, you know, superficial, and then you can work your way down. So those landmarks are going to be really important for you guys as you move on in the curriculum, like to do like joint mobility assessment with the cervical spine. So make sure you guys can get a good feeling for it. And again, you can C1 especially can definitely feel a little bit movement there once you do the side bending or rotation for that matter. And then from there, it's just, so right there, and you can just work yourself down. Tender there, Chris?
No, it feels good actually. Yeah.
And you can work all the way down to C7 again. So this is hard to feel, so see if you can you know, get some practice on. This is a very tough, especially the C2 to C7 spinous processes is not very easy to find. So if you have any questions, just let one of us know.